Now, senior, teach and explain, not chide and condemn. That recommendation to health and government officials as skepticism about the COVID-19 vaccination program continues. As it is in every other country, there are several people in Jamaica who are apprehensive about the COVID-19 vaccine. Some have even taken protest action to voice their mistrust of the new jab. However, social history professor at the University of the West Indies, Mona, Vereen Shepherd, explains that this hesitancy is not only based on conspiracy theories.
I say teach and explain rather than chide and condemn. The Black community's distrust of the vaccine and medical research and advice that they are asked to support is rooted in a long record of mistreatment. Dr. Reed Tuckson, co-founder of the Black Coalition Against COVID-19, has explained that the late 1900s were defined by medical breakthroughs, but that many of these experiments and discoveries were made at the expense of Black people's human dignity.
The forced use of experimental drugs and procedures on enslaved Blacks created this early mistrust for medicine. Reggae entertainer and Rastafarian Tony Rebel is among the critics. He pointed to US lawsuits in the 1980s linked to previous vaccines.
Enough people might look for me and say, yeah, I'm a Rastafarian and therefore I deal with conspiracy theory. But the truth is, do you have an idea about 1932 when the Tuskegee experiment happened in America?
According to which, U.S. Public Health Service systematically denied 600 Black men infected with syphilis of treatment for this curable disease, while lying to them and telling them that they were being treated.
Based on this history, many, including Tony Rebel, believe the global administering of a new vaccine is tantamount to an experiment, and so question the quick global acceptance.
Don't roll over and play dead and take everything that these organizations present to us. We must have our team that can do serious research, because every time I listen to the news, all I hear is that we're going by what the WHO says or what CDC says. Where you are say?
But speaking at a vaccination town hall meeting on Friday, Professor of Public Health and Epidemiology, Dr. Peter Figueroa, refuted the experimental argument. As part of the World Health Organization team that reviewed the AstraZeneca vaccine, he insists that it's based on a decade of SARS coronavirus vaccine research. He's defending its efficacy and safeness. Professor Shepherd believes there's only one way to achieve the over 60% vaccine take-up that's required in Jamaica.
I think governments and medical doctors need to be understanding, even though it might be frustrating.